is Dr. Julie Holland. I'm a veterinarian in Littlestown, Pennsylvania. I own and operate Littlestown Veterinary Hospital.
Examining a healthy cat.
So today we have Axel with us. Axel's a 5-year-old neutered male kitty cat. He's been pretty healthy except when he was much younger. He fell off a bookcase and broke all the bones across his little hand. But after having a cast for quite a while, that healed up beautifully. And he's a very friendly, outgoing cat. Many cats, when they come in here, are pretty scared, but Axel isn't really scared of much of anything. So I'm going to lift you out of your box here, bud. When cats are more scared, we leave them in the box because they feel a little better when they're hiding there. But like I said, Axel's pretty good. One of his concerns is that he's a little chunkier than I would like to have him. Is he having any other problems?
Not at this time.
Good boy. All right, let's see what you weigh. He's having attachment issues. All right. Trim those nails too. There you go. Sit on the scale. Good boy. Okay, so he's 12 pounds, 8 ounces, which is actually a pound less than he was last time. So good job, Mom. So we take notes about all our patients and we transfer them into the computer when we get there. All right, so we look at everything about him. He looks good, his coat looks good, he's grooming well. This is a silly amount of hair for any cat, so that's really important because it's a lot of hair to take care of. And as you see, Axel doesn't have a tail, and neither does his sister, who's going to be next. So we look at their ears, we feel all over their body to see if there are lumps or bumps anywhere. One of the most important things we do is look in their mouth and see if they're getting a lot of dental tartar, see how their teeth look. He is getting a little bit of dental tartar. It's not to the point where we need to clean his teeth yet, and like I said, he's a very, very good patient. So I also am going to listen to his heart. Feel his abdomen a little bit, make sure there's nothing unusual in there. The other thing we feel for in these long-haired cats is they have a bunch of mats underneath their belly, which he does not. He's in pretty good shape. All right, sweet pea. All right. So his heart sounds great, no concerns at all. And basically everything looks good. He's still maybe a little bit too heavy, but basically he looks terrific. So we've examined him all over. I'm gonna give him his vaccine. His rabies shot is not due this year, so he's just getting a distemper shot. That lasts for 3 years. He doesn't really go outside, and he's always really, really good for vaccines. All right, so Mr. Axel, you can go back in your carrier and we will move on to your sister.
And things look a little bit different when the cat is nervous.
All right, so this kitty's name is Grumps McGee. She's the sibling of Axel, who's much calmer, but you can tell they're brother and sister. She's also got long hair. She also doesn't have a tail. She's never had any health problems. She's always been really healthy, but she is very scared and she spends a lot of her time hiding. So instead of pulling her out of the box right away, we just take the lid off and put a cover on it so she feels a little more safe and protected, and I can start handling her a little bit where she still feels like I can't see her. So what we do with these kitties is we just take one little corner up and we look at one little piece of the kitty and see how that looks. We check them for fleas. She's just got a super, super soft coat. So like a pumpkin. She's sweet. She's very scared. She's not outgoing terribly even at home. Good girl. A lot of cats like to have their butt scratched. And there she is, coming out for us a little bit. All right, babe. She's also smaller than her brother a little bit, which is hard to tell when they're so fuzzy. All right, so her ears look great. Good girl. I'm going to listen to her heart before I weigh her because sometimes getting out of the carrier is a scary thing and it increases their heart rate. So I'm just going to cover her head up a little bit again. 9 pounds, 2 ounces. Very good. Very good girl. All right. Feel her belly. She's got one little mat here. Is she having any health problems at all, or is she doing well?
No, she does periodically get them around her neck right there, so I'm not surprised. But she'll typically tolerate like one big snip and then we're done.
Okay. Yeah, it's not a very big one. Let me see this side. Good girl. Her teeth are excellent. They're actually better than Axel's. All right, sweet pea, let me put you back in your carrier and we'll give you your vaccine. Vaccines, the injections, are not usually the worst part of the exam for animals. It's the being scared in a new place and just being worried. All right, so Miss Grumps is done. We're gonna put her carrier lid back on and she'll be all set to go home. She looks great too.
Examining a dog looks pretty similar to a cat, checking their heartbeat and their mouth and their fur and their weight, but when they get vaccinated, it can look a little bit different.
Okay, so we are ready to vaccinate Atticus today. He is going to get one of his vaccines as a shot, and the other one is a liquid medicine, kind of like a cough syrup that he'll have to swallow in order to be protected. All right, so this one. Okay, so we are ready to vaccinate Atticus today. He is going to get one of his vaccines as a shot, and the other one is a liquid medicine, kind of like a cough syrup that he'll have to swallow in order to be protected. All right, so this one, we're going to give him the shot under the skin, just like if you or I were getting a vaccine, we might get it in our arm. As you sit, you sit, sit, come here, sit.
Good boy,
Perfect.
good boy, good boy.
So for this, we're just going to lift up his hair, and it's going to go in his skin and in between his shoulders, and just like that, he's all done.
Good boy,
He's
good
all
boy.
done. Good boy.
Good boy.
Good boy. So for this one,
Ooh, yummy.
there you go.
That's a good boy.
That's a very good boy. Very good boy. You are a good boy. Here, you have a treat.
There we go, good boy.